All right, let's get right into it. We're going to be talking about one of the toughest, most persistent problems in the U.S., the huge gap in health based on your race, and what happened when a massive law, the Affordable Care Act, tried to fix it. And let's just kick things off with a pretty shocking fact. Here in America, your race can literally be a predictor of how long you get to live. And this isn't some isolated issue. It's a reality across the entire country, even in states that we think of as having top-notch healthcare. So to really get our heads around this, we first need to understand the scale of the problem. What does this health divide actually look like in real numbers? This chart right here, it really tells the story. It shows something called premature avoidable mortality. That's a fancy term for people dying before the age of 75 from conditions that we can either prevent or treat. And just look at the difference. For Black and American Indian/Alaska Native people, the rate is just worlds higher than it is for white Americans or Asian Americans. We're talking about people dying from things like diabetes or heart disease, deaths that just shouldn't be happening with good, timely health care. So you see a chart like that, and the first question that pops into your head is, why? I mean, what is actually causing this massive life or death gap? Well, it's not just one thing. It's a whole mix of complicated, tangled-up reasons. Part of it is what happens inside the healthcare system. Historically, people of color are more likely to be uninsured, which means they often have to delay getting care because they just can't afford it. Many don't have a regular family doctor. And then there's the very real problem of racism within healthcare itself, where studies show people of color can get a lower quality of care. But it's also about what happens outside the clinic. Bigger issues like poverty and housing segregation that make it harder to be healthy in the first place. So into this situation, this landscape of really deep inequality, comes this massive piece of legislation. Let's talk about the Affordable Care Act, the ACA. So the ACA, which was passed back in 2010, was really the biggest change to our health system in decades. And the main idea, the whole point of it, was pretty simple on the surface. Get more people health insurance, especially low and middle-income Americans who were falling through the cracks. So how was it supposed to do that? Well, it basically had a two-pronged attack. First, for the lowest income adults, it expanded Medicaid. That's the government insurance program. Second, for people who made a little more money, it created these online marketplaces where you could buy private insurance, and it offered subsidies, basically financial help, to make those plans affordable. So two different paths, designed to cover two different groups of people. Okay, so that was the plan. Now, more than 10 years later, the big question is, did it work? What kind of progress have we actually seen? I mean, just look at this number, 20 million. By 2016, that's how many people got health insurance who didn't have it before. That is a huge, historic drop in the number of uninsured people in this country. A massive change. And this chart, this shows you exactly where a huge chunk of that increase came from. The states that said yes to expanding their Medicaid programs saw enrollment jump by 36%. The states that said no, well, they still saw a little bump, but only by 12%. So the data is crystal clear. Medicaid expansion was the real engine driving these coverage gains for the poorest Americans. And this wasn't just about having a piece of plastic in your wallet. It had real, tangible effects on people's lives. We saw huge drops in the number of people who had to put off seeing a doctor because of the cost. More people had a regular doctor they could go to, and more people started getting preventative care, like checkups and screenings. But, okay, that's the good news. The story, though, isn't over. Even with all that progress, we're still not at a place where everyone is covered. So who's being left behind? Which leads us to this question. After all that work, after millions of people got insurance, is the problem solved? Well, the short answer is no. Not even close, really. Today, there are still 25 million people in the United States without any health insurance. The ACA made a serious dent, for sure, but there's still a big hole. And a huge reason why is something called the coverage gap. Now, remember how the ACA was set up? Medicaid for the poorest folks and subsidies for people starting at 100% of the poverty line. Well, in the states that didn't expand Medicaid, the old rules still apply, and you have to be really poor to qualify. This created this trap. You have poor adults who make too much money for the old Medicaid, but not enough to get the subsidies for the new plans. They are stuck right in the middle with absolutely no affordable option. So if you look at who's still uninsured, you see it's not just one type of person. A big slice of that pie is people stuck in that coverage gap we just talked about. Another huge group are people who are actually eligible for help, either through Medicaid or the marketplace, but for whatever reason, they just aren't signed up. And then a significant number are undocumented immigrants who are legally shut out from getting these benefits. Okay, so we know who's being left out, and we know why. That brings us to the final and maybe most important question. What can we actually do about it? How do we bridge this gap? Well, the folks who study this stuff have a pretty clear roadmap. It really boils down to 3 big steps. First, the most obvious one, have the last 10 states finally expand Medicaid to close that coverage gap. Second, for the people buying their own plans, the idea is to make them even more affordable, better subsidies, lower costs. And third, it's about investing directly in healthcare on the ground, making sure there's strong primary care in the communities that need it the most. So, the policy solutions are on the table. We kind of know what needs to be done. The real question, the one that's much harder to answer, is what's it going to take to get it done? What will it take to finally close America's health divide for good?